Mr. Lorenzin, Professor Rasi and Professor Percorelli, authorities and ladies and gentlemen, thanks and good morning and welcome here in Italy. And it's my pleasure to be here today, and thanks for inviting me to do this other speech, because I think that the industry in the world, in Europe, but especially in Italy, can play an important role in the aspect of vaccination. The European vaccine industry is a strategic sector not only to protect citizens, health and economy, but also to respond efficiently to the emerging health threats. You have to know that 79% of the world production is in Europe, and in Italy we employ more than 2,600 employees in the vaccine production and R&D, and especially we are an exporting country because 180% of vaccine export growth is in Italy compared to the 7% of the rest of the overall industry. And also, the growth in Italy in 2014 of the export for vaccine has been 61% compared to 26% of the rest of Europe. Nowadays, citizens are always more informed on health issues and at the same time dissatisfied with the service provided. And the vaccine is one of the areas in which we should put more attention than in the past. In many cases, they are flooded by information, but paradoxically, they risk to be very uninformed. That's why it is essential to give them appropriate means to recognize quality and scientifically based information. A lack of information might generate distrust in health strategies. As a consequence, Europe is experiencing declines in vaccination coverage for preventable disease, along with eroded confidence and trust in the value of vaccines and vaccination. And we all know that where vaccination coverage is inadequate, disease returns. We all have the responsibility to reverse this worrying trend and develop targeted and effective communication strategies involving all stakeholders on the value of vaccination, especially oriented on young people who will be the parents of the future when it will be possible to eradicate even more debilitating diseases. Farmindustria does its part collaborating with the project Vaccinarsi, that is a website in which people can find information about vaccine and vaccination shared by representatives of the Italian Society of General Practitioners. Vaccines are one of the most cost-efficient investments for national healthcare system. In a system with limited resources, it's not only the amount of expenditure to determine the state of the health of the country, but the way it spends. It's important for the national healthcare system to invest funds in a strategic way in order to provide with appropriate medical care and improve patients' quality of life. Healthcare systems should be even more focused on disease prevention, also through vaccination, because prevention is a smart investment in terms of well-being and efficiency growth of the healthcare system. For example, it reduces the cost arising from diseases and contributes to the sustainability of the national healthcare system, and it contributes to the growth of the country, decreasing absenteeism at works. I want to give you some data. The vaccine annual expenditure per capita in Italy is only €5, and it is one on 10 the cost-benefit ratio in Italy as outcome of flu vaccination of all citizens between 50 and 65 years old. And for every €1 we spend in vaccination, we are saving €24 in drug treatment for patients that are not vaccinated. So we need that to dedicate assets to vaccine. According to what's stated, it would be appropriate to commit specific assets and resources to vaccines, as indicated by the Calendario della Vita, in order to ensure the achievement of vaccine coverage as requested by the WHO organization, and allow the introduction of innovative vaccines that may be able to make the real difference in terms both of public health sustainability and quality of life improvement. Furthermore, secure assets dedicated to vaccine may allow to Italian regions to plan efficient vaccination policies. I know that we will discuss a lot about the regional situation in this country just today, but I think that it would be necessary to consider the achievement of complete vaccination coverage as an element for measuring general managers' work in health districts in order to confirm their role. The best vaccine in the world has no value if people do not use it. So that's why everyone must do their part to ensure the success of vaccination policies. So I thank you and I wish you an enjoyable work today, because I think that This meeting is really important for the future of vaccination, not only in Italy, but in Europe and in the world. So, thank you.